My name is John Mosley. I'm the Executive Vice President and Chief Strategy Officer of Spectrum Health. First of all, the mission of Spectrum Health is to improve the health of the communities we serve. This is an extremely important part of us and what we do and our purpose. And we've been very dedicated to improving the health of the communities. The community care clinic will actually be started as a area in the community to clinic that will be for the underserved people in the community. And that's just starting this year. That was part of our community health analysis and looking at the community needs assessment. We also help participate in improving dental services throughout the community. And in the core health program, we're not only looking at people that have congestive heart failure, diabetes. We're going into the homes to make sure we're improving their health and nutrition. The program Puente, we go to the Hispanic community and make sure that we're providing them with assessments to find out what kind of issues they have and how to help them solve those issues in terms of high blood pressure, obesity, and chronic diseases. Without partnership, this doesn't work. And so our position has always been, we want to be a part of the community, a part of the community that solves the problem, not an individual island in the community. And I think it's so important when you talk about what we're trying to do and how you really make a difference in the community. The Core Health Program, which we are honored to have sponsored, is a community program that really gets people from the community helping others that are in the community, those people that are in the most need. And to actually get into those homes and to do the job, you have to be known in the community. It's not a place where everyone would be welcome.
I'm Patty Carabelise. I'm the Director of Community Health Programs for Healthier Communities at Spectrum Health Hospital in Grand Rapids, Michigan. It's so rewarding. And there are so many people that we work with because our program works with the underserved. There's a lot of folks that have kind of ended up in situations and they don't really know where to go. They don't have anybody in their life to turn to. And our staff, they're able to go out into these patients' homes and really get to know them, and they care about them. And they'll call them and check on them. How's it going? How was your doctor's appointment? And they might be the only person that's doing that for our patients. You know, we have patients that never leave their apartment or house. The neighborhood they live in is too dangerous. They just don't want to go out. They don't feel well. They're depressed. We have a lot of mental issues with our patients too, and if they're not taking their meds, they're not feeling good. We have our staff, they listen to them and they really try to work with them and say, come on, let's go walk down to the mailbox and let's go get your mail. Let's go for a walk. Even if it's 20 steps, they'll take the time and do it. They'll meet them at the supermarket and help teach them how to grocery shop, because so many people don't even have that skill set. So it's really rewarding. You don't get to really kind of cure everyone, but for the folks that you do get, it's so rewarding to everyone.
My name is Erin Inman. I work for Spectrum Health in Grand Rapids. I am the Director of Healthier Communities. We focus on community partnerships. We recognize that as a community, our bandwidth is much greater when we look collectively to each other, looking at resources, not only from a financial aspect, but also from a human aspect. We look to improve the communities of West Michigan through those collective efforts in focusing on chronic disease management, focusing on areas of disparity, and focusing on the integration of healthcare services into the community, no longer a episodic care, but also that holistic care of the patient.
The Nobel Award is sort of the pinnacle of public health, and we think that by winning that, it demonstrates our commitment, but also shows that we continue to be continues to be an important part of our community and what we believe in. But it's extremely important because it recognizes the people that work so hard.